with the Q&A. We are having a couple of questions. So first, I think it goes to Dr. Sheetal. It is regarding BFSI sector. So Dr. Sheetal, your take on what would be the impact of this lockdown due to COVID-19 on banking and financial sector in India? Would you like to comment on that?
Which sector?
BFSI, banking and financial sector.
I think that, you know,
yeah.
Yeah, I think that, you know, banking and financial sectors, you know, there is such tremendous amount of uncertainty, and it's all going to boil down to you know, what the macro policies, the government's monetary and macro policies are, or what is their broader vision. At this point, I think the finance ministry has issued a stimulus package, and so and this is to help, you know, the economy, you know, and I think that there is a feedback loop from all of this into the financial sector as well. If the consumer sentiment and the investor sentiment sort of changes, then we may not see that very big sharp comeback. And in that case, I think the banks and the financial sector are also going to probably need support from the federal government.
Right. So I would take up the next question. We would try and finish off the questions from the participants first, and then we may have, if it requires, then we may have some other discussion as well. So next question is from Sanghita Jadhav. She's asking to Dr. Rajiv that when can be the restrictions on airways can be lifted according to you? I think actually they have lifted already. They have been having this exercise of bringing back people from abroad to India. They haven't opened it completely. What would be your take, Dr. Rajiv?
Just can you say that the last word?
Dr. Sangeeta Jadhav is asking when can be restrictions on airways can be lifted?
Airways, okay. Very good questions. As I said, that the third lockdown, because airways, the problem is the tracking the person, correct? So when you open the airways, the tracking the person becomes very difficult, the confirmed case. So I will suggest that it will only open at the last, when at the district level the problem is solved and at the state level problem is solved. Once the state level problem is solved, that I will say that each state is almost in the green zone. We stop getting positive cases, then we can open the domestic flights. And obviously it is very clear that in the world, if it stops any confirmed cases, I will not say it will not happen all confirmed cases, but we can always take a call and say that if it is limited, and then we can only open the international flights.
Right. So I'll move on to the next question. It has been asked by Purushottam Sen. Is asking how important is the quality of data? With probably the one of lowest testing rates and misclassification of cause of death data, there is probably chance of significant errors. So he's asking about quality of data.
Okay, it's a very valid question. It's a very valid question. I would like to answer it in two ways. One is that what you should do if you don't have the quality data. Still, we should keep working. That is my first statement. The second statement, as I said, that we are also not getting the testing data district wise, because it is happening only the state wise. Having said so, but India is not doing badly, let me tell you. It's a very big effort. They have already conducted 12 lakhs or more than 12 lakhs test data. in those test data itself, you can always raise the questions. Here,
Right.
I would like to say one thing. Nowadays, the school of thoughts have changed. One school of thought says that whatever data you have, you do the modeling based on that. I repeat, whatever data you have, you do the modeling based on that, which was changed to the previous thought, which used to say that until unless you have the data, you don't do the modeling. I hope I am clear.
So
Right.
let's chime in here. I think what Rajiv is trying to say is that, there are, you, it's absolutely true that we need more testing. In India, the testing rate is not comparable to the developed world. And it's obviously boils down to resources as well. And likewise, as you said, there are also coding errors, etc. And that is because we're not fully equipped. India is not fully equipped to deal with, the healthcare system is not equipped to deal with the crisis. But the current decisions are being made based on this data that we have. Good, bad, or ugly, this is the data we have. Of course, many efforts should be, and concerted efforts should be put into increasing the testing rate and accuracy of the tests. But what we are suggesting here is that, here's another way to utilize the data that we do have. So we do know what is the ICU capacity of a particular district. But when we think of the lockdown decision, we're not taking that into account. We do know what is the what are the likely transmission vectors and how they differentiate across districts. What are the possible ways of people to deal with their daily needs? Those also vary across districts. So we're just saying that given the data, conditional on the data, there are other ways to think about the metrics that you can use for doing this zoning or this grouping.
Right. So one aspect of what Dr. Rajiv said, I found it very interesting, and also one has to dwell upon that. He talked about opening up the local markets first, and then perhaps then maybe moving with the state uh, tra- the state transports that we have started right now for the last couple of days. So one question regarding to that has been asked by Makarand. He's from New York. He's been asking how we can make something work for migrants on walk, because you have been talking about local opening up local markets first. If that would have done, would that have been benefited? Would that have been somewhat benefited to the migrants and the situation that has been right now? We have had an accident in the early last morning, where 16 migrants had to they lost their lives. So would that have been averted? So what we can do in terms of migrants on walk, Dr.
So
Raju?
preface this by saying that we don't know the counterfactuals, of course, and so we can say speculatively what we think would be the you could have been if the local economies or the local districts were opened up, and then migrants were tried to there was a concerted effort to sort of help them both economically and from public health perspective. So clearly we live in a globally interlinked world. So when the demand falls and the factories close, and when the factories close, these workers don't have employment, and they don't have resources to make their daily needs met. But the fierceness of the lockdown, one, it also generated a psychological sort of fear among these migrants. Second, if we had approached it at a very decentralized level in the districts, all these stimuli packages, all the aid, all the food that we're trying to now distribute to ultra poor and poor, the distribution itself would have become an easier task if they were not just, isolated now in various places, waiting in relief camps to go to their homes or such. So doing it at a district level would have been easier. It wouldn't have necessarily solved all their problems, of course, but whatever resources we did have, the dispersal of those resources would be much easier at a district level if we were trying to absorb the migrants in the local economy. So that's my perspective, but I'm sure that Rajiv wants to add to that.
No, you said it all, Sheetal, but the question is very valid. Unfortunately, I think there is a delay of 3 days in the communication. If government would have taken a decision saying that the open markets, now local markets are open, and these persons can be taken into the local activities, this could
Right.
have be avoided. It is very unfortunate that this happened, and now also I think that slightly it is out of control. Uh,
Hmm.
but if we can manage it and we can convince the persons that okay, local markets are opened in many places, and even if those places which are not open, at least we can guide them that okay, you can go to the neighbor place and can work on it.
Right. Definitely. I completely agree with you. There was one of the suggestions given by P. Sainath on this, that we could have opened up our schools, private institutes. We do have many in every district. So we could have accommodate these migrants for in those in that infrastructure, and we could have opened, as Dr. Rajiv is suggesting, if we could have opened the local economy, then the people, the migrants would have got some engagement over there, and this situation perhaps might have been averted. So I think that is a great suggestion. So moving with the next question, is asked by Kalyan Kuluri. She's asking to anyone, both from you can may like to answer this. How do you calculate the picking of the curve based on Topsis model? Are they linked or are they different exercises?
Can you just please repeat it?
Yeah, I would repeat. How do you calculate the peaking of the curve based on the Topsis model, TOPSIS model?
Okay.
Are they linked or are they different exercises?
So she's asking
Okay.
about the
Yeah.
peak, the infection
Peak.
rate or
Uh, Very
index.
correct. So as all of us know that I think there are number of models which which was really appreciated was the Singapore model, and then there was a Manhattan model, there was Oxford model also. But unfortunately, this peak model, uh, I don't want to say failed, but yes, it was tried, but it could not predict properly. They have used the logistic models. We also have used three type of exercise. We have used tried logistic models, which people have tried. We have used the normal distributions, and then we also have used the machine learning, where we have used three methods. One is the decision tree, second is the Gaussian progression, and the third is SVM. Why I'm saying like this is that yes, it is a very difficult task. So that is the reason I have repeatedly said, that please understand this is just a kind of tool to you. Okay, it's very difficult to predict the peak. Okay, we can fix some models. Why I'm saying it is difficult to predict the peak? Because of the reason that these certain activities which takes place. For example, when we open the market, local market, when we open the district markets, when we open the state market, then what happens is the interaction increases. And when the interaction increases, you don't know how to take care of that. But just to assure you this, not confirming anything, not boasting anything, we are trying to develop a model, which is, I am calling it as random variable model, where we will try to simulate the interactions. And hopefully in next 5 days, we will be able to predict something, which will be
Right.
based on the peaks as well as the human activities.
Right.
Thank you.
So if I may chime in here,
Please.
I think the question is how are the peaks being incorporated in the criticality index. So if you recall, we have those vectors. We have 8 or 9 attributes. So infection rates, recovery rates, death rates, those are all inside the TOPSIS analysis, and they are given weights. So now these weights are something that we can't ascribe. That's why we are saying that experts and you know so for example, for peaks and determining transmission rates, the opinion of epidemiologists who are at the disposal of policymakers and governments, those would matter a lot. So they would say what the weight is on a particular criterion. What the model is just doing is saying, here are some attributes. It's better to base your decisions on a number of these attributes with different weights, rather than just saying that our objective function is to just not open a place for 21 days if there is any case reported. So unfortunately, it's become a pandemic, and infection is going to progress. And that said, the weights can be changed, the attributes can be changed as well. So it's in that sense very dynamic, and it's also automated very significantly. So you don't have to. There are no lags or delays to recompute things. But of course, these opinions would have to come from experts on how these interactions happen. So that's the dashboard fund, which is related to TOPSIS, criticality index, and opening of the economy. There's yet another exercise that Rajiv and his team are doing in terms of forecasting to help prepare better. And that's where he's just mentioned that he's even going to simulate interactions and when you open up, what would happen.
Thanks, Sheetal. I missed this particular point. You are very correct. How TOPSIS is taking care. Thank you.
We are running out of time, so I would take last 2 questions. One to Dr. Rajiv and second to Dr. Sheetal, and then we would have to close because of the time. We have to take care of time as well. So, Dr. Rajiv, according to you, now what everybody's asking, when this would end? Do we have any forecasting for it?
I take it in 2 ways. One is in a positive way, and one is my professional credentials, correct?
Right.
So in a positive way, I will say, yes, it has to end. There is no other go. My expectation is it all depends upon the kind of activities which we do. But it's a very good sign that what we are trying to do is that till the time we get the kind of remedy, vaccine or anything, if we can keep our profile low in terms of the diseased patients, it will be very good. Having said so, yes, we are facing a lot of problems. It may convert into economic losses. It may convert into job losses and so many other things. So basically, it is a trade-off between 2 of the things. And defining the exact deadline that when it will end, I can only say that it depends upon our own activities in what way we take the decision. According to me, the decision should be open, close, open, close, open.
Right. So that would be the strategy. Now we have been hearing this new term that we would have to learn to live with this. And we have been also getting some news from China that they have even opened their schools. So whatever you are suggesting would be precisely that. But we have to go with the right strategy, and the strategy that you have been suggesting, we have been finding it very so innovative. At the same time, we have been finding very anybody who knows India and the circumstances in India, what has been happening in India for last couple of days, especially from the standpoint of an administration. I personally feel that it is one of the best works that we have come across. So last question would be to Dr.
Sheetal wants to add something, I think.
Yes, Dr. Sheetal, please.
I just wanted to add that, you know, this is also a function of individual behavior. We have to ourselves realize that we have to keep social distancing and other, you know, precautionary policies in place. There are countries who've not locked down aggressively, but, you know, in behaviorally, individuals have, you know, imposed such type of restrictions on themselves, which goes a long way in helping this open close model.
Right, very right. So last question to you, Dr. Sheetal. Would you like to comment on the stimulus package in India, which has already been announced, and most of them are expecting that there will be some more to be announced in the future. So what would be your take on the stimulus that has been announced and should have been announced by the government of India?
I think it's a step in the right direction. Without stimulus packages and, you know, other type of social support systems, the poor and ultra poor are not going to be able to cope with this very well because they don't have fallback mechanisms. So that said, also, you know, if we want to recover from this in a sensible manner, then these stimuli might go a long way in restoring investor and consumer confidence as well. I think there was a stimulus package announced for 120. It was $22.5 billion, and so that is going to be, you know, it's not it's very good, but it's still not, you know, commensurate to the type of losses we're going to face in India. The unemployment rate in India as of April is about 4 times as United States, but the stimulus package in United States is much more sizable. Of course, it boils down to resources in the end, and as the government has said that there would be other plans to help. What I think the magnitude of it is going to have to be revised as we open the economy and we see, or what, as and when we need to shut it again, what changes occur in you know, the demand side of the economy. That said, the other issue is, and this is very critical, is, you know, how we disperse it. We at macro level think in the ministries that, oh, we did announce a very good package, but there is a distribution chain, so it has to very quickly and very efficiently sort of come together so that this reaches the beneficiaries. Only then it is going to help, you know, those who are intended.
Right. Adding it to one of my personal and the final question, Dr. Sheetal, do you think that the timing does matter for this, that it would have been announced way before and it is taking some time to be announced now? So would that be a variable, one of the major variables?
I mean, I think it's going to have to play out. This timing of announcing stimuli packages is also very intricately connected with, you know, what are you doing in terms of lockdowns. One of the other big benefits of doing it is that it gives you time to prepare. You know, it gives you the time to deal with the crisis and to better prepare and streamline your systems, both public health and economic support. So I'm not privy to the information about what the government has done in terms of, you know, dispersal systems, but because the lockdown has been extended several times, the announcement itself, if it had come early, my sense is that it might have held a little bit with the consumer sentiment, with the markets. It's possible, but on the other hand, if government has utilized this time to better prepare to deal with, you know, disbursing, then I think the timing may have been good. But it's going to play out as things open up, because there is a lot of uncertainty in terms of, you know, what will happen to the disease progression as you know, the migrants return, and also when the economy opens up.
Right. So thank you very much. Now we have been arranging these kind of discussions on various aspects, not just related to COVID-19, but in general, what we should have, what is the state of Indian economy and what it would be post COVID-19 as well. So this was one of it, and I personally enjoyed it a lot, because what we are promoting at CASPER, Center for Advanced Studies in Policy Research, is interdisciplinary studies, and this is one of the best studies that we could have had, and especially at the time when it is required the most. We have come across. I wish that gets a good attention, and governments also would start thinking on utilizing these kind of models. So thank you very much, Dr. Sheetal, Dr. Rajiv. We would be having Dr. Neeraj Hatika tomorrow. He would be presenting his work, which he has done using logistic distribution model, and has tried to estimate the spread of COVID-19 in India. So we would have that tomorrow at 6 p.m. in the evening. So the participants, I would request participants to join in again tomorrow for one more discussion. So right now, thank you, Dr. Rajiv. Thank you, Dr. Sheetal, for joining us from all the way from Visualise and from University of Virginia, USA. We appreciated that you gave us your time, and I thank you from behalf of all the participants. We had a wonderful discussion, and that was definitely a key takeaway for all of us, the perspective that we are getting out of your work. So thank you again. Should we close now?
Thanks,
Yeah.
Sandeep. Thank you everyone for a very stimulating discussion.
It definitely was.
And thank you, Mr. Sandeep, and all the participants. And I will be more than happy if you can share your opinions on with us, Sheetal or myself, so that we can improve upon our models. That is more important. So the basically discussing this model was not to say what we are doing, but what we are trying to contribute. So if you say send your suggestions, I feel that it will complete our objectives. Otherwise, it will not. Thanks a lot. Thanks a lot.
Thank you very much, sir. Thank you very much for joining in. Thank you very much.